Wisdom teeth are the set of molars that are located the furthest back in the jaw. There's three main types of wisdom teeth. The first type is what we call fully erupted. That means it's just like all your other teeth. You can see them in your mouth when you open. The next type is one that's under the gum. It's not completely visible. You may be able to see a little bit of it. And then the third type is where it's actually completely under the bone. So using this model, we can actually illustrate what a bad wisdom tooth looks like. So in this case, this is a sideways wisdom tooth. It's actually just going to cause more issues over time. So with these, we do expect at some point a cavity forming on the tooth in front of it, an infection forming in the gums. This is a perfect example. As you can see, all four wisdom teeth, they're not coming in properly. They're kind of coming in at angles. This is actually a great time to have the teeth removed, where we see about half of the root of the tooth formed. This is a patient who's around 18 years old, and that's kind of the ideal time. We get asked the question, hey, my teeth are completely out, can I keep them? The hygiene is very difficult on a tooth that far back. It's really difficult to floss it, really difficult to get your toothbrush back there. In most cases, we're still gonna recommend you have them removed. If you're experiencing discomfort towards the back of your jaw, some swelling or discomfort of the gum, those are all indications that you would at least want to get your wisdom teeth evaluated. Over time, what we tend to see is a cavity forming on the tooth in front of it. The patient who lets that happen over time will end up losing both of these teeth. More expenses, more surgeries. Thankfully, the process of removing wisdom teeth is pretty straightforward and actually painless. The first step is actually putting you to sleep, and that way you won't hear, smell, see, feel, taste anything that's happening, and waking up and it's all done. So it truly is a painless procedure. So you're asleep, but you're still there, but you won't remember any of it. Sometimes we can give you the option of just using some local anesthesia, laughing gas, things like that. Typically after the procedure, we're gonna recommend you stay on a soft diet for the first 3 to 5 days. No straws and no sodas. Patients can typically expect a 3 to 5 day period where they may experience some throbbing, swelling, or aching kind of towards the back of the jaw. Most of that can be mitigated with Advil, Tylenol. When that tooth comes out, we don't want to leave a hole in your jawbone. So we'll actually fill that hole back in with bone. We call that a bone graft, and then we're able to stitch and seal it shut. Give us a call. The first step is we'll bring you in for a consult where we'll take a CT scan and then kind of walk you through the process of what that would look like. And in many circumstances, we will be able to do the consult and the procedure at the same time in the same day. So fun fact, why are they called wisdom teeth? And it's actually because when they're starting to develop and come out, it's usually around those later teen years, that coming of age where you're starting to now gain wisdom and get a little bit smarter. But other than that, do they give you any extra wisdom? Definitely not.